I want to just show you how to get a patient up the first time. Because on our unit, we have found that if patients get sitting at the edge of the bed and standing as soon as possible, even if they're not actually walking, they do progress a lot faster and their other risks are reduced. So I want you to feel comfortable moving people like that. I'm going to assume that Sarah is a patient with an operative knee replacement. The way that we get her up will not change regardless of what surgery that she's had, okay? So I'm going to show you how to get Sarah out of bed and into bed, and then how to help her sit down on a chair and stand up again, okay? And I find the simplest way to get people up is to ask them to shimmy to the edge of the bed. So that's great, Sarah, you're doing a good job. Good, and then I want you to push through your arms to sit up. Now often I'm supporting with my hand here. We're going to have our patient push through their arms to wiggle themselves around. They can use a sling on the operative legs, but the first time that they get up, and probably the second time too, you're going to need to also provide support so that they're more comfortable and feel more confident. So I recommend one hand holding the sling, the other hand on the bed. So can you get your good leg out of the bed? And now I'm going to support your sore leg underneath the calf here as they bring it down to the ground. Now we're going to pretend that Sarah is a little on the shorter side of things. I know that our same-day home patients will be on stretchers, and the stretchers don't go very close to the ground. But it's really painful for someone after a knee replacement to have their legs dangle. So this is a situation where you might, if they're just sitting up for the first time, take one of those footstools and have them rest their feet on the footstool for increased comfort. Also, if they're short, their risk of sliding off the bed is a little higher, and that puts you at risk as a nurse as well. So this will keep all of you safer. When she goes to stand up, I'm going to take away the sling, and I'm going to remove her feet from the footstool. And she is going to have the walker in front of her before she slides to the ground. And then you're going to push from the thing that you're sitting on. You can have one hand on the walker, but not both. Good. And then most of our patients can put as much weight as they want through their feet, but they will need to put a fair amount of weight through the arms so that they can stand safely. Now, when people walk, we want them to move the walker first, then the sore leg, and then the good leg. So I'm going to have Sarah turn and sit in a chair. So she moves the walker, then the sore leg. Walker, then the sore leg. Walker, then the sore leg. That's when she's going forward or turning. When she backs up, she's going to back up the good leg first, because now her hands are supporting the sore leg as she steps back with the good one. Okay? When people go to sit, the good leg should be touching the thing that they're going to sit on, whether it's the chair or the commode or the bed. And then they're going to step the operated leg forward because it hurts less. If a knee bends, it's going to hurt more than if it's straight. So if you reach your hands back to the arms of the chair, and you might have to slide your foot a bit more as you sit, but we encourage them to keep their foot on the ground as they slide it forward because it hurts less. When they go to stand up, they don't have to have that foot forward. For some reason, it doesn't seem to make much of a difference. Okay? Push from the arms of the chair to stand. And now as she turns, she's going to do the walker first, then the sore leg. Walker, then the sore leg. And as she backs up, the good leg comes back first until she can feel the bed behind her. And then she's going to extend the sore leg a bit and brace her hands on the bed so that she doesn't flop down, because that hurts quite a bit. And now, because she's a little on the shorter side, I'm going to bring this footstool underneath here. And I'm going to help you with your sore leg. Pardon me there. I wasn't quite ready. Pardon me. Okay, now she's less at risk of falling, so I'm going to have her wiggle back a bit. There we go. And now I'm going to take this out of the way. I'm going to take your sore leg. And I'm going to have you turn your leg. I'm holding under the calf. Sometimes I'll just take both legs because it's easier. Sometimes I'll just hold the operated leg. Now, if she was taller, I wouldn't use the footstool at all. And on the orthopedic unit, I hardly ever use a footstool. But our beds go quite a bit lower than the stretchers do. So I'm not sure at this point whether that's going to be something that you'll need or not, but we thought we'd just incorporate it so that you know what the possibilities are. So the principles would be the same after a hip surgery. You still want to extend your leg a bit when you go to sit down. For comfort's sake, legs dangling is still painful, although not quite as painful as someone after a knee surgery. And that is the technique. We do find the first time up, sometimes people have a bit of a postural blood pressure drop, and so if they can just sit there for a while, it's helpful. And certainly if they're not medically stable, I wouldn't get them up to a chair. But the same technique to get them onto a chair is what you need to get them onto the commode if they needed to go to the bathroom. And we usually bring the commode to the bedside if they haven't actually walked, have them transfer at the bedside onto it, and then drive them on the commode to the bathroom. Okay?